Every Thursday, we highlight stories affecting consumers. We've partnered with Kaiser Health News and NPR on their Bill of the Month series, which uncovers shocking medical bills. This morning, we're looking at how emergency room fees are fueling rising healthcare costs. Between 2009 and 2016, ER charges nearly doubled. They are rising at 4 times the rate of overall healthcare spending, according to the Healthcare Cost Institute. One Colorado man told us he got hit with a huge medical bill after celebrating a little bit too hard at his bachelor party.
The following day had a pretty bad hangover.
By evening, Cameron Fisher was so nauseous, his fiancée Caitlin decided they should skip their own rehearsal dinner.
He just couldn't hold anything down. I wanted to take him into the hospital just to make sure that he was okay and ready for our wedding.
At a freestanding ER outside Denver, a blood test confirmed Cameron was dehydrated.
It was 2 liters of saline. It took about 30 to 45 minutes to go through all of it.
The groom felt great on their wedding day, but Cameron's stomach was back in knots a few weeks later when the hospital bill arrived.
That was the price for the actual room.
The total, more than $12,000, including a $7,644 facility fee, $700 for 2 bags of saline, and charges for tests he says he didn't even know were ordered.
What they told me was that by signing the consent form whenever I checked in, that authorized them to run any and all tests.
North Suburban Medical Center said in a statement, when patients present to our emergency room, board-certified physicians examine and address their medical needs. The amount patients pay out of pocket for their emergency room care is based upon their insurance. Cameron's insurance company negotiated the bill down to roughly $4,700 and paid nearly $2,100. He owes the rest.
My wife and I just recently found out that we're pregnant, so that's money that would be going to making sure our child is actually cared for.
Dr. Elizabeth Rosenthal, editor-in-chief of Kaiser Health News, joins us at the table. Doctor, good morning.
Good morning.
So your website reported that the 2 bags of saline solution were available at Walmart for $10.99.
Right.
Instead of $700. And if you go to Walmart, there isn't a multi-$1,000 facility fee like you got hit with.
Right.
So, I mean, this was double the cost of his actual wedding. What do people need to know?
Gosh, well, you have to know, first of all, you play defensive. Emergency rooms are going to be, the markup is going to be 30, 40, 50 times what would be available on the outside. So I always tell people, and you know, poor guy, think twice before you use an emergency room. Do I really need to go there? So we've had people who come in our Bill of the Month series for a splinter, and you know, $8,000 later, they're like, damn, I could have gone.
But they finally said that the nearby urgent care centers were all closed.
Right.
So what option do they have then?
Well, that's part of the point. Unfortunately, you have to play kind of defensive medicine as a patient. You have to know, when did the urgent care centers close around my locale? So I always tell people, if you think you might need to go before they close.
Go now.
Because the ER is going to be much more expensive. The other thing is you can have a primary care doctor. This kind of thing, if you had a doctor you had a relationship with who had after-hours call, you could say, hey, I had this, I have a really bad hangover, I'm getting married tomorrow. He could have prescribed some medicine to calm down the nausea, and then Cameron could have probably drunk water his way back.
That was my response.
Drink water. I've also heard that Pedialyte is good. I've seen in
Yes.
young people's homes they have Pedialyte and they don't have babies. And I was wondering, how does that work?
You can use Pedialyte, or I worked as an ER doctor, and we experienced this. You can give people dilute kind of semi-warm ginger ale, works nicely.
Yes.
Anything.
But what about the blood test? Also, what you said about the doctor, he or she, I think it's always good to have a good relationship with your doctor, maybe have a number where you can reach him or her after hours.
Right.
But the other part of the story that stood out to me was about the blood test.
Right.
That he was charged for a blood test that he didn't even order.
Right. Now, so the other thing you can do defensively is when you go to an emergency room and the doctor or the nurse says, we're just going to order some bloods. You can say, why? What are they for? I mean, this young man knew exactly what was wrong. So all that blood stuff wasn't probably necessary. And ER doctors frequently, they're not bad people, but they're kind of ordering from a checklist. Kid who's nauseous, check.
Dr. Elizabeth Rosenthal, thank you very much. We appreciate it.